at this year's ITOC, just last week, what I tried to do is to try to summarize some of the key issues that we're facing when trying to apply cellular therapies to solid tumors. And we and many others in the field have shown that both clinically and preclinically, these are the access of these cells to the tumor tissue, because if that does not happen, then you'll never see an effect. Then it's the engagement of the target cell, the tumor cell, by the T cell, or by the immune cell in general. And that is massively limited by heterogeneity of antigen expression of cancer cells that in the end prevents a single antigen from adequately seeing from a single CAR T cell or therapeutic T cell to adequately see its intended target. And last but certainly not least, a fact that we've seen and known for a very long time in solid tumors, which is immune suppression locally at the tumor site, so suppressing a local immune response, but of course also this happens systemically in these cancer patients. And in my presentation, I tried also to give some insights and avenues of what we think might be suitable strategies, both coming from our group, but also from other teams. So one aspect is an important and essential aspect is clearly to enhance the recruitment of these cells to the tumor sites, and I could show, at least in preclinical studies, that this works very nicely using chemokine receptors to recruit these cells to the tumor site. And of course, this will need to be confirmed in further preclinical, but also clinical work. I've shown that modular platforms, some of them we've pioneered ourselves, like the synthetic agonistic receptor platform or the PG-LALA-CAR platform, and that these could be used actually to selectively target cancer cells. And by doing so, to allow both to control T cell activity in the sense that if we stop giving the compound that is necessary for the activity of these cells, and the cells just stop being active. And also that this system allows us to switch the antigen of target and eventually also to target multiple antigens at once with one therapeutic T cell. And that with the focus on antigen heterogeneity of cancer, this could be a huge advantage in treating tumors. And last, so I've also given some insights and some avenues on what we think could be suitable strategies to prevent immune suppression to act on therapeutic T cells. And we believe this could be done both by means of engineering, we've shown that, and as well as via the supply of exogenous compound that would just prevent the action of some suppressive molecules on the cancer cells. And ultimately, we believe that all of these aspects will need to be tackled in a therapeutic product to allow, to really unleash and allow the full efficacy of immune cells and of T cells in solid tumors.